8. Weird signs of heart damage you must not ignore. When you think of heart problems, what comes to mind? Chest pain? Shortness of breath? Maybe even a dramatic collapse like in the movies? While those can be warning signs, the truth is that heart damage doesn't always announce itself in obvious ways. In fact, some of the earliest signs of heart trouble are so subtle that most people overlook them entirely. Many believe that only older adults or people with unhealthy lifestyles need to worry about heart disease, but that's simply not true. Even if you feel fine, silent inflammation, chronic stress, and even poor dental hygiene could be quietly damaging your heart right now. And the scariest part? By the time traditional symptoms appear, the damage may already be severe. Today, we're revealing 8 surprising signs that could mean your heart is in trouble and what you can do to protect it before it's too late. Stick around, because the truth may shock you. Sign 1. Calf swelling or pain. Have you ever noticed your calves feeling sore, cramping up, or even swelling, especially after walking or climbing stairs? You might chalk it up to dehydration, overexertion, or just aging. But these seemingly minor symptoms could be signs of peripheral artery disease, PAD, a condition where your arteries become narrowed or blocked due to plaque buildup, restricting blood flow to your legs. PAD often goes unnoticed because it doesn't cause sudden sharp pain, but instead causes dull aches and fatigue in the legs. When blood flow to the muscles in your legs becomes restricted, they don't get enough oxygen, causing the muscles to ache, cramp, or swell. While this might seem like a simple circulation issue, PAD is strongly linked to heart disease and strokes, as it's caused by atherosclerosis, the buildup of fatty deposits inside the arteries. Atherosclerosis can occur anywhere in the body, including the arteries that supply blood to your heart, increasing the risk of heart attack, heart failure, and even stroke. Ignoring this sign of calf pain or swelling could lead to severe complications, including heart disease or even limb amputations in extreme cases. The good news is that PAD is manageable, and you can improve circulation and prevent further damage. Regular physical activity, a heart-healthy diet, and quitting smoking can all help protect your arteries. If you're experiencing persistent calf pain or swelling, don't ignore it. A simple checkup with your doctor can help catch PAD early and prevent further complications that could put your heart at risk. Sign 2. Bleeding gums and gum disease. You might think that bleeding gums are just a minor issue, a sign you brush too hard or haven't been flossing regularly. But did you know that gum disease could actually be linked to heart problems? Chronic gum disease, also known as periodontitis, causes inflammation in your gums and allows harmful bacteria to enter your bloodstream. Once these bacteria make it into your bloodstream, they can contribute to the formation of plaque in your arteries, leading to narrowing and hardening of the arteries, also known as atherosclerosis. The connection between gum disease and heart disease is rooted in inflammation. Inflammation is the body's natural response to injury or infection, but when it becomes chronic, it can cause long-term damage to the body's organs. Both gum disease and heart disease are driven by this chronic inflammatory response. Research has shown that people with gum disease are more likely to develop heart disease, strokes, and other cardiovascular issues. This is why good oral hygiene is about more than just having fresh breath. It can directly affect your heart's health. To protect yourself from the hidden dangers of gum disease, start by practicing excellent oral hygiene. Brush your teeth and floss daily to prevent plaque buildup and remove bacteria before they have a chance to enter your bloodstream. Also, eating anti-inflammatory foods and reducing stress can help lower the impact of gum disease on your overall health. If you notice red, swollen, or bleeding gums, don't dismiss it as a minor issue. Your gums might be trying to tell you that your heart is at risk, and taking action now can protect your heart in the long run. Sign 3. Snoring or sleep. Apnea. Snoring is often seen as a harmless habit, a sign that someone is just getting a good night's rest. But did you know that loud, persistent snoring could be a sign that your heart is under stress? Snoring, especially when it's accompanied by pauses in breathing during sleep, could indicate sleep apnea, a serious condition that disrupts your sleep and also puts immense strain on your cardiovascular system. Sleep apnea occurs when your airway becomes partially or completely blocked during sleep, leading to repeated interruptions in breathing. Each time your breathing stops, your oxygen levels drop, causing your heart to work harder to maintain normal function. Over time, This cycle of oxygen deprivation and heart strain can increase blood pressure, cause irregular heartbeats, and elevate the risk of developing heart disease and strokes. It can also lead to daytime fatigue, morning headaches, irritability, and difficulty concentrating, symptoms that often go unnoticed or are blamed on other factors like stress or poor sleep hygiene. The dangers of sleep apnea aren't always immediately obvious, but untreated sleep apnea can significantly increase the risk of serious heart complications. If you snore loudly or find yourself waking up feeling exhausted despite a full night's sleep, it could be time to consult with a sleep specialist. Treatments like a CPAP, continuous positive airway pressure machine, which keeps the airway open during sleep, can drastically improve symptoms. Additionally, losing weight and avoiding alcohol before bedtime can help alleviate sleep apnea symptoms and reduce its impact on your heart. Don't ignore snoring. It could be your heart signaling that something needs attention. Sign 4. Sudden extreme weakness. Have you ever felt sudden, overwhelming weakness that makes everyday tasks seem impossible? This isn't just regular tiredness. This could be a sign that your heart is struggling to pump blood effectively. When the heart fails to circulate blood efficiently, oxygen levels in the body drop, causing your muscles and organs to work harder. This results in extreme weakness that comes on quickly and doesn't improve with rest. Unlike regular fatigue, which can be relieved by a nap or a good night's sleep, extreme weakness due to heart problems persists and can interfere with even simple activities. This sudden drop in strength can be a warning sign of a potential heart attack. When the heart isn't pumping enough oxygen-rich blood to the organs and tissues, they begin to malfunction, causing weakness, dizziness, and shortness of breath. Many people ignore this feeling, chalking it up to stress or being overworked, but it's important to take it seriously, especially if it's accompanied by chest pain, dizziness, or nausea. If you experience sudden extreme weakness alongside any of these symptoms, you should seek medical attention immediately. Early intervention could prevent a life-threatening heart attack. Sign 5. Skin rashes or unusual spots. Most people don't associate their skin with their heart health, but did you know that chronic skin conditions like eczema or psoriasis could be linked to heart disease? Both conditions are caused by inflammation, and inflammation plays a significant role in the development of atherosclerosis, the narrowing and hardening of the arteries. When the body experiences chronic inflammation, it can cause damage to blood vessels, leading to a buildup of plaque in the arteries that increases the risk of heart disease and strokes. If you've been dealing with persistent rashes, red patches, or scaly skin that doesn't seem to improve with treatment, it might be worth considering the bigger picture. Chronic skin issues could indicate that your body is dealing with systemic inflammation, which can affect your heart and blood vessels as well as your skin. The first step is to see both a dermatologist and a cardiologist. Managing inflammation through a healthy diet, rich in anti-inflammatory foods, reducing stress, and treating the underlying skin condition could help protect both your skin and your heart from further damage. Sign 6. Unexplained nausea or indigestion. We've all had an upset stomach at some point, whether it's from something we ate, stress, or a minor digestive issue. But what if that persistent nausea or indigestion isn't coming from your digestive system at all? What if it's actually a warning sign from your heart? When the heart has trouble pumping blood effectively, it can affect the digestive system, causing symptoms like nausea, bloating, or indigestion. This is especially true for women, who are more likely to experience nausea as one of the first signs of a heart attack. Unlike typical digestive discomfort, nausea caused by heart problems can be accompanied by dizziness, shortness of breath, or discomfort in the chest, jaw, or back. If the nausea doesn't go away after eating or if it's paired with other signs of heart problems, don't ignore it. You may be dealing with a serious issue, and seeking medical attention right away could save your life. Sign 7. Persistent cough or hoarseness. A persistent cough or hoarseness is often blamed on allergies or a cold, but when these symptoms linger, it could actually be a sign of heart trouble. When the heart isn't pumping blood efficiently, fluid can build up in the lungs, leading to a persistent cough or hoarseness. This is commonly seen in people with congestive heart failure, a condition where the heart can't pump blood effectively, causing fluid retention in the lungs. Unlike a typical cough caused by a cold, a heart-related cough is usually dry and persistent, and it may worsen at night or when lying down. If you experience frequent coughing, hoarseness, or difficulty breathing, and these symptoms are accompanied by swelling in your legs or shortness of breath, it's important to see a doctor. Ignoring this sign could lead to more serious complications, but early detection can help manage the condition before it worsens. Sign 8. Fainting spells. Fainting might seem like something harmless, a result of standing up too quickly or skipping a meal. But if fainting occurs suddenly and without warning, it could be a serious sign that your heart is in trouble. Your brain requires a steady supply of oxygen-rich blood to function properly. And if there's an issue with your heart rhythm or if an artery is blocked, blood flow to your brain can drop suddenly, causing fainting or lightheadedness. Fainting spells can be caused by several different heart problems, such as arrhythmias, irregular heartbeats, heart valve disease, or blocked arteries. If fainting occurs during physical activity, is accompanied by chest pain, or happens more than once, it's a medical emergency. Don't wait for the next episode. Seek medical attention immediately. Ignoring this sign could lead to dangerous complications, including a heart attack or stroke. Your heart works tirelessly to keep you alive, but are you giving it the care it deserves? Many of these warning signs are subtle and easy to overlook. By recognizing them early, you can take action before serious heart problems arise. From maintaining a heart-healthy diet and regular exercise to managing stress and seeking regular checkups, these small changes can make a big difference in your heart's health. If any of these signs sound familiar, don't ignore them. Take action today and protect your heart for years to come.